There's been a lot of discussion about the Roe v. Wade decision, and now women across the country are trying to make better decisions about their health. Dr. Kristin Bell, thank you so much for joining us today. And we were talking about this during the commercial break. We're going to take the politics out of it.
That's right.
We're just going to help women make decisions moving forward. There are
Absolutely.
a number of options when it comes to birth control. Can you talk about some of those options and who is the best patient, the right candidate for those birth control options?
Yeah, absolutely. So really, whenever it comes to birth control, you have to figure out what your reproductive goals are. So if you want to get pregnant within a couple of months, maybe a year or so, you would want to stick with a shorter acting method, like birth control pills that you take every day, the patch that you change once a week. There's a vaginal ring that's good. You just change it once a month. There's also a new one that's good for an entire year. If you want to wait a few years to conceive, you would try the depot shot you can get every 3 months. The Nexplanon, which is the little rod that goes in the arm, it's good for 3 years. And then there's intrauterine devices. One's good for 5 years and one's good for 10 years. Once you're finished with reproducing, that's when you would consider something like a tubal ligation, or tying your tubes. Also, just to mention, there is vasectomy as well, and just kind of to know, the vasectomy doesn't require general anesthesia or abdominal surgery, so that's actually safer. If males are finished with reproducing, that's a great option that they tend to not think about.
And
so,
I think that's
yeah.
one of the things that hasn't been talked about widely, is that there are options for men when it comes to birth control as well. And as a practicing physician, it's your job to talk about both ends of that.
That's exactly right.
Yeah, I know a lot of people are concerned about their overall health
Yes.
as women. And,
Yes.
and when we look at certain age groups, people who are more susceptible to different things, what do you see as one of the challenges in moving forward with this new law?
Yeah, oh golly. You know, as far as different age groups go, all women, all menstruating people need to understand that all of these birth controls are safe in any age group. They also will not affect your future fertility. So if you're worried that, oh, I take birth control, I might not be able to have babies later, that is not even close to true. All of these methods are thoroughly studied, so they are safe. As far as picking a different method goes, you know, it doesn't matter so much the age, but some medical problems matter. So, you know, if you smoke or have history of clot or high blood pressure, you need to let your women's health care provider know, because they would need to help you pick the right option. Something else that I wanted to touch base on is emergency contraception, because that's something that we don't always remember. If one has unprotected intercourse, you can go straight to the pharmacy if you're 17 or above and pick up Plan B. It is over the counter. If you're under age 17, then you can get a prescription from your doctor. You need to take it within 72 hours of unplanned intercourse. There is also the copper IUD. As long as you have it placed within 5 days of unplanned intercourse, you are good to go.
Are there any long-term impacts from Plan B or any other emergency contraceptive?
No, not at all. That's
Right.
the beautiful thing about it. It just prevents an unplanned pregnancy, and then your reproductive health is intact.
One of the things I keep hearing you say is talk to your women's health care provider.
Yes,
Have a
absolutely.
relationship with your doctor.
Please do.
What
Yes.
do you say to women? Because we know that there are huge disparities in health care
There are.
when it comes to communities across the Midlands. What do you say to women who don't necessarily have that one doctor that they can go to tonight?
Oh golly, just know, first of all, I'm taking new patients, so I would be happy to see anybody, everybody. We take all insurances, and you know, educating is part of our job, and I will see you in a heartbeat. Next, the South Carolina Health Department is readily available too for those who, you know, need immediate care or assistance. So that's something to remember.
Dr. Bell, thank you so much for spending a couple of minutes with us and for the great
Absolutely.
information.
Yeah.
All right, we're going to send things back in the studio to JR.